Before I came to HRSA, I didn't know that HRSA existed. Hi, I'm Paul Davis with the HRSA Learning Institute.
Jacqueline Ramirez.
Margaret Bykowski.
Brianna Allen.
I work on various projects such as evaluation of our classes that we offer. I help out with the trainers.
This summer I worked at HRSA's Health Systems Bureau under the Countermeasures Injury Compensation Program.
I also worked on the negotiated rulemaking committee for the designation of medically underserved areas and populations and health professional shortage areas, which is a mouthful to say.
This summer I've been working with the nursing scholarship program. The scholarship program basically pays tuition for nursing students in return for their service to work in clinics in underserved communities. So if we give them a year or 2 years of money, then they owe us 2 years of service in an underserved community.
They work with countermeasures specifically, so in smallpox, botulism, anthrax, N1H1, and any other countermeasures that are declared by the Secretary of the Department of Health and Human Services. And it's primarily compensation for any individuals that receive any adverse effects from any of the products used.
We were doing a documentation tracking process, so we traced decisions back that the committee had been making. And that's important to know for government transparency purposes. So if someone comes up and says, why has the committee made this decision, you can say, well, here it is. It's in this documentation that I got to work on.
I can physically see the impact they were making in the communities. Their funding for the clinics and stuff. I just feel like these services are things that our nation would really miss. You know, it's behind the scenes work, but if we aren't here, people aren't getting nursing scholarships from the government. And then in return, people aren't necessarily going to work in underserved communities.
The most valuable thing I did over the summer was the evaluation project, because that's something HRSA needed, and we need to be able to compare our data from class to class, ranked by dates. So that was a very important project.
I do like the service and the impact I'm making. I feel really effective. I pay you, you come work with us. It's a really effective way of doing things.
Serving underserved and underinsured populations and other vulnerable groups. I think it's very important, especially given the difficult times there are, that there's an agency committed to that.
Consider HRSA because it is an important agency. The work that it does is vital to the healthcare of this country. Furthermore, on a practical level, you will learn skills that can take you to other federal agencies and in the public sector as well.
HRSA's most important function would be the work across the country supporting healthcare systems